Hi, my name is Maria Lopez-Velez, and I'll be giving an informative speech on Vogt-Koyanagi-Haradas Syndrome or Disease, VKH. 23.5 million Americans are affected by some type of autoimmune disease. This is according to womenshealth.gov. The Census Bureau says that there are over 235 million Americans and counting. So when you take these two numbers, it equates to about 7% of Americans who have some type of autoimmune disease. To decipher what VKH is, we're going to go over a couple of definitions that I'll be discussing or touching on as I discuss what VKH is. The immune system. Your immune system is your body's own defense mechanism against foreign invaders, diseases, germs, bacteria, that thing, to keep you healthy. Autoimmune disease. Autoimmune disease is when your own body attacks your own healthy cells by mistakenly thinking that they are foreign invaders, thinking that they're germs for whatever reason. Corticosteroids, those are replacement steroids that are made in the labs. They come in either pill form or liquid form. Alopecia is rapid hair loss that is caused by an autoimmune disease. Vertigo is the loss of pigmentation. It could happen in your skin, in your hair, your eyebrows, or your eyelashes. Glaucoma is the pressure behind your eyes. A lot of people, it comes to mind use of marijuana. Cataracts is when the inside of your lens is clouded, and you've seen it in older people. Kind of looks like their eyes are kind of white. Earlier I had said that there are over 325 million Americans and 23.5 million are affected by autoimmune diseases. In the U.S., VKH occurs in 1.5 to 6 patients per 1 million patients. That's the first time I have ever heard a number be placed. Usually in the websites or the researches that I've done, it says that VKH is so rare and happens in such few cases that the U.S. doesn't even keep numbers. Okay, so what is VKH? Not a lot is known, so I'll give you the little bit that we do know. Between 1906 and 1929, Drs. Vogt in 1906, Dr. Haradas in 1926, and Dr. Koyanagi in 1929 began discussing their patients and the ailments that they were having, how a lot of them were having issues with their eyes and their ears and their heads and neurological hearing and things of that nature. In 1932, a doctor by the name of Babel suggested that all of these ailments that they had were actually connected and termed the illness VKH, or Vogt-Koyanagi-Haradas disease, which is what it's known now. We know that VKH is autoimmune. That means that the medical community does not know how or why this disease comes about. It is non-infectious, so you can't pass it from one person to another. It is multisystemic, so it doesn't only affect one part of your body. It affects your eyes, your ears, your headaches, different things like that. Pigmentation, hair loss. There are 3 categories for VKH. It is complete VKH, incomplete VKH, and probable VKH. Complete VKH is considered when you have retinal detachments or fluid buildup in your eyes that gives you loss of vision. You have neurological problems like the headaches and things of that nature, and auditory problems, the tinnitus. You also have, the other one is incomplete VKH. That is also the retinal detachment or the fluid buildup, and either the auditory problems or the neurological problems. And the probable VKH is where you just have the ocular problems, the eye problems, and they might also term it uveitis. Who gets it? VKH is prevalent in pigmented people, in darker pigmented people like Asians, Middle Eastern, Hispanic, Native American, but they found that it is very infrequent in people from African descent. The onset is normally between the ages of 30 and 40, but they do have cases where it's occurred in as young as 4 years old. It affects both men and women. The ratio is 2 women to 1 man, so it's not gender specific. How do you get rid of it? There is no cure, but there is treatment. The treatment, usually how you get diagnosed with VKH is you have a bunch of different doctors that work together, but the telltale signs is made through the ophthalmologist. The ophthalmologist will diagnose you with VKH based on the x-rays of your eyes, not the x-rays, but the testing of your eyes. So after you're diagnosed with VKH, they will put you on a high dose of oral steroids. If everything goes well and your system reacts good to the oral steroids, as time passes and your body reacts good, they'll start to taper you off little by little off of the steroids. And hopefully by the time you get to 0, your immune system would be quiet and you would go into what is called remission. If not, there's different options. They could put you in on a higher dose of steroids and then work you down that way, or they could put you on oral steroids, or they could put actual steroid injections into your eyes and try to work it that way. That's to get the inflammation down. Once they get the inflammation down, if your immune system is quiet and you don't need any further testing or any further treatment, and you're in remission, then that's it. But sometimes you might have to be put on some autoimmune medication. At that point, you'll be sent to a rheumatologist. The treatment for autoimmune illness, autoimmune medications is very similar to arthritis, the medications that they put people on for arthritis. You'll go there and you'll be evaluated, and they'll give you this medication to suppress your immune system. Again, there is no treatment. They just hope that in treating your immune and keeping your immune system and keeping it quiet, that there'll be no further flare-ups and that you won't get the fluid buildup in your eyes and the retinal detachments. In conclusion, it is very important that you know and you keep up with your body. Nobody knows your body better than you. It's better for you to err on the side of caution and have a medical professional tell you that what you have is normal, instead of having to look back and say, I shoulda, coulda, woulda. I'm grateful that I took notice of what was happening with me and that this disease was caught early enough that I got my vision restored. I'm not back to where I was before my diagnosis, but I'm a lot better than I was at my worst point. Once again, VKH is a very rare disease or a condition. It is autoimmune and it affects very few people, 1.5 to 6 patients per 1 million here in America. Thank you. Goodbye.